Together we achieve victory over heart failure.
Hi, myself Dr. Jwala Kumar, cardiology resident at IGMS Patna. Today I am going to deliver 5 essential insights on heart failure. As we know, the heart failure is a silent epidemic that India is combating. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for the heart failure. Unlike the Western countries, where the heart failure is predominantly a disease of elderly people. Now, what is the heart failure? Heart failure is the heart is unable to pump blood throughout the body. The blood, because the blood essential for the every cell tissue of the body, blood carries the oxygen, which is the proper functioning heart pumps all over body, and so they get every cells get the oxygen for their metabolism. So in the heart failure, heart is unable to pump blood, so the all tissue of the body not get adequate oxygen, so that the metabolism get hampered and patient get symptomatic. Symptoms of the heart failure are dyspnea, exercise intolerance, fatigue. Now let's break down the 5 essential insights on the heart failure. One, firstly, what does it mean when a doctor tells you that you have the heart failures? When people get a diagnosis of heart failure, they think it's the end of their life. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently it should be. The term ejection fractions measure how well your heart pumps the blood to the deliver oxygen to the body cells. It is the amount of blood pumped out of your heart lower chambers called ventricles, left ventricles, each time it contracts. On the basis of the ejection fraction, the heart failure classified into heart failure with major ejection fraction when the EF is greater than 50%, heart failure with reduced ejection fraction when the ejection fraction is less than 40%, and mid-range heart failure when ejection fraction between 40 to 50%, and normal EF is around 50 to 70%. Secondly, why are so many Indians affected by heart failures? Here the genetic play a significant role. Indians are generally more vulnerable to cardiovascular disease. Furthermore, Indian people have comorbid conditions like hypertension, diabetes, obesity, and smoking habits. These comorbid worsen this epidemic of the heart failure. Thirdly, moving on, what are the signs and symptoms of the heart failure? So watch out for the patient complain of confusion, fatigue on walking, heart palpitation, nausea, indigestion, shortness of breath, weakness, exercise intolerance. There is also loss of appetite, vomiting, and sometimes patient may be initially asymptomatic. Four, how can we protect ourselves from this disease? Our heart work incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor to the heart. What are they? Early detection of heart failure through regular consultation and blood checkup and the 2D cardiography ECG. Secondly, dietary adjustment to the maintain heart health. Third, incorporating daily exercise into your routine. Practicing stress management technique. If a patient addicted to alcohol, tobacco, smoking, quiet alcohol intake, tobacco, chewing, and the smoking. Fifth, lastly, what are the comes next after a heart failure diagnosis? Thankfully, medical science offer numerous treatment options. It is possible to lead an enjoyable, meaningful life and productive life with the proper treatment. Heart failure medications improve quality of life. Devices like biventricular pacemaker, implanted cardiovascular defibrillator, heart valve repair, replacement, and last resort option is the heart transplant. The lifetime risk of heart failure is 1 in 5th for both are men. So for the heart failure, awareness and preventive mechanism are key factor in combating this silent heart failure epidemic. Thank you.